My name is Amanda Sloup, and this is my Educated Citizen presentation. The public issue that I chose to talk about is childhood sexual abuse. I chose this topic because it is something that has been more relevant in conversations in the more recent years. It's always been an issue, especially in the United States. And however, it just wasn't widely talked about until the last maybe 10 to 20 years. It's important to discuss because abuse of a child happens every 9 minutes, and over 65,000 kids are abused in the US every year. I um, I chose to talk about this because I have personal experience in this situation, and I think that it's more common than people realize. Um, Again, we just need to be discussing it to be able to solve this issue. So, an effective communicator is somebody who uses critical thinking to generate, connect, and organize ideas in a written, oral, and nonverbal manner. At my time at Methodist College, I have been I have been an effective communicator multiple times, and I've just been working on this since being a freshman to a senior. So, one experience that I wanted to talk about was when I was working as a CNA at Children's Hospital. This was back in about 2018. I was an aide on the fourth floor, and this particular experience was my first my first time with a Spanish speaking patient. So the patient was too young to speak at all, but the parents and the family themselves did not speak any English at all. And I think it really scared me because I realized how little knowledge I had of the Spanish language, and just how little I was able to communicate with them. So I used what knowledge I did have to just kind of communicate the basics, but then I took that opportunity to go and look up the information I needed as far as just talking about cares and asking them questions. And I wrote things down, and I used that to help me communicate to them. I think I learned that I really did know more than I thought I did. However, the things that I didn't know, I was fully capable of going and figuring that out to be able to communicate with this family. And I think that this definitely relates to my public issue because in the future, I could use the knowledge that I have to help communicate with families who don't speak any English. I have since gotten a minor in healthcare Spanish, so I think that will help me down the road as a nurse. But it just goes to show that we're fully capable of bridging that gap between the language barriers. Another experience that I've had was what more recently, excuse me, I was working as a CNA at Douglas County Health Center. So this is a long-term care facility, and I was assigned to patients on a memory care unit. I had to really kind of learn how to communicate all over again because talking to patients with dementia is completely different than talking to patients who don't have a memory care issue. Um, I think that I learned that communication really has to be catered to fit the specific situation that you're in. And I learned how important nonverbal communication can be. It's just as important as its verbal counterpart. Um, I think that this experience can help me really improve my nonverbal communication, especially because my public issue deals with children. A lot of them may be nonverbal. A lot of them may be just too scared to talk about their experiences and their situations. So, just really what communication specifically, like what form of it fits to the situation, I think can help me be a better nurse and a better person in general. So the next part of the educated citizen is a reflective individual. This is somebody who routinely engages in habits of inquiry that influence ways of thinking and actions. So, an experience that I wanted to talk about as a reflective individual was um, another time when I was working at Children's Hospital. Um, this time in particular, I remember I was in a room that had isolation precautions, and the patient was a pretty not an like a teenager, but a child who was nonverbal, who could not turn or do any cares themselves. So I was basically on my own, and I realized that they had a BM and there was a lot to clean up, and I unfortunately couldn't do it all myself. So I was trying to get into contact with somebody so I didn't have to leave the room, take off my gown, and I didn't want to leave the patient as they were because it was unsafe. So I opened the door to look out into the hallway because no one was answering my calls, and I saw a nurse practitioner, and I told her, "Oh, never mind," because she had other patients to go worry about and care for. But she asked me what I needed, and when I told her, she said, "Oh, let me come in and help you." So she ended up putting a gown on and everything, and came in, and she helped me clean up my patient and make sure they were all good to go before she left the room. And I remember when I was talking to her, she told me she remembered what it was like to be a CNA and then a nurse and then a nurse practitioner. She said, "I used to do this all the time. It's how I started out." And so I think what I learned from this experience was that no matter what our titles are, as long as it's within our scope of practice, that it's really important for us to help others because they could be struggling in a certain situation, and even the tiniest thing we do for them could make a huge difference, not only for them, but then for our patients too. She definitely made me realize what kind of nurse I want to be. So I really got to reflect on that. And I think that because my public issue involves helping such a vulnerable population, it really connects to my time at Children's because this was a vulnerable population. It was children as well. And um, it definitely helped me think about how we as a team help them. And so I learned that I always want to be that person who helps others when I'm able to, including the survivors of sexual abuse. So another experience that I had was actually during a clinical at the VA. I was able to witness a few procedures, including thyroid therapy or thyroid biopsy, thoracentesis, and a transjugular liver biopsy. I believe that this was a case of being a reflective individual because I got to really hone in on my knowledge that I had learned previously to be able to ask the doctors and the surgeons in the moment, like questions about what was going on, but also like critical thinking questions. Um, they were relevant to what was happening so that I could connect my past and my present learning. And then I got to go on and talk to the class about it. So I think that using my buildup of knowledge to ask the right questions and really utilize that critical thinking can help me figure out the why of a problem. This is really important in order to see the best solution in a situation. And this applies directly to my my public issue because in order to solve this public issue, we need to be able to figure out the why so that we can figure out the okay, how do we move forward? How do we solve? The third part of an educated citizen is a change agent. And this is somebody who uses the discipline of the liberal arts and sciences to analyze historical and contemporary situations and systems to develop um, cultural competence and take appropriate initiative to affect change. So, one of the times that I embodied being a change agent was during another one of my shifts at the the long-term care job that I work at. What I did in this specific instance was bring about change for a resident with dementia. So um, they're all during dinner time. They're all either independent or dependent, and the dependent ones being feeders. So we as the aides have to help them eat their dinner. It's for various reasons. They can't physically lift the food to their mouths. They can't chew very well. A lot of them get distracted because they do have dementia. They don't really realize. Sometimes they'll take a couple bites and then try to stand up and walk away. So that's why we're there to help. This instance was a resident who wasn't already considered a feeder, but I was noticing them having some issues. And I think this was maybe the second or third time that I really noticed some issues. And at this point, it was getting to be a bigger problem because they weren't getting the nutrients they needed. So I took the initiative to sit down and help them eat their dinner. And I talked to the nurse about it. We discussed the changes that were happening in their affect and their behavior, and we decided that they should be put on the dependent side of things. So she talked to the provider, and then the next time I was in, that resident was actually considered a feeder. So that really made me feel better that I could, even in such a small way, it seemed at the time, affect their care in a positive way. I learned that the combination of my observations and my knowledge really gave me those correct tools to bring about change. And again, something that can make a big difference, even if it doesn't seem like it in the moment. And I think that this applies to my public issue because when we're able to use our voices, when we notice something that isn't right, that's the only way we're going to bring attention to that issue and ultimately bring about the change that's needed in that situation. Another instance where I felt as though I acted as a change agent was also at my job at Douglas County Health Center. I had the idea to go pick up some personal care items for the residents. A lot of times we don't have the time during the evenings to be able to do little things for them, but I decided one day that I wanted to braid a lot of the women's hair, and I curled some of their hair. It wasn't just me who did it, but I started doing it, and then some of the other aides that I was working with, pitched in. We got to do a decent amount of their hair, and it just made me feel better, making them smile. I mean, again, it's something that seems so trivial in the moment, but if you think about it, I mean, you go to the hairdresser, you feel a lot better afterwards, and especially for these people that this is their home, they don't get to do it themselves. They have a memory care problem, and they don't get to do the things that they normally used to do. So I think that it really helped change a lot of their negative behaviors because it made them really happy in the moment, and it helped them the rest of the night with the cares we were doing because they were in such a good mood. It wasn't such a fight to get them into bed and to get them changed and everything. So it really taught me that it doesn't take much to improve somebody's mood, and that it really is included in my job as a CNA because I take care of them holistically, not just physically. So I think that children who have been abused may just need somebody to simply listen to them. Um, it's a little bit different than the case that I had experienced as at my job, but again, something so small such as listening to somebody, making them feel heard, can really turn their mood around and make them a lot happier. So I think this is what the change agent is about. So, in conclusion to this presentation and this project in general, I feel like from my time of when I started at Nebraska Methodist College, when I first started working on the Educated Citizen project, um, I've changed a lot in very positive ways, and I think it really helped me to be introspective on who I am as a person and then who I'm going to be as a nurse. I really feel a lot more prepared for my career, even though, yes, I'm going to be really nervous going into it. At least on this side of things, I can be a lot more prepared. And I think in general, it's just made me a more well rounded person. I feel as though I am really able to embody what it means to be an effective communicator, to be a reflective individual, and to be a change agent in order to really make a difference in the lives of those around me. And here are my references, and that is it. Thank you.